Sex education be taught in schools. Sex education should be taught in schools because children will get be more informed and have good information. Information will be given to them concerning sex as well as their health, their well-being, and also information on STD. Information for these classes can be gotten from the parents, so that also be aware of what's going on and what the school is trying to offer. Because not every child has a parent that they can go to and is willing to speak to them about the concerns that they have regarding these issues when it comes up for them. And instead of them getting information from wrong sources, they can get it there if they don't have a parent, as well as from parents who want to speak to their children. And that will probably help cut down on some of the unwanted pregnancies, as well as a lot of sexual transmitted diseases that the kids that are happening to children today. In my office where I work, I have seen where kids come in as young as 12 that are not pregnant, but they have contracted an STD, and parents aren't even aware that they're sexually active. And when the parents are told about this, they are very, very surprised, and they don't know what to do. That's when the doctor will take them in the office and speak to them. We've had cases of herpes, we've had cases of trichinosis, we've had cases of gonorrhea, and all these things have to be reported to the Department of Health and Human Services because they have to be tracked. And I think with the parents not being aware that the kids are sexually active, and the schools will be, a good place where they can also learn about these things. And even if the class is taught as an elective or something like that, it should be made mandatory in some sense, in some cases where the kids can learn it, and the parents can even come in when this information is being taught to the children. And I think that should be done. There are different types of birth controllers on the market that kids can also be made aware of. It's not just a condom or the pills. I have just a printout of different types of birth controls that, if the parents are willing to, can be given to the children, and they can, with permission, of course, and information that the kids can be given these things, so it can also help, in prevention of pregnancy for the children. And I also think that it's not every child is sexually active out there, and props to them, because they're not concerned about the disease and stuff, because they're not having sex. We have 53% during the survey that said that they are not having sex, and we have two-thirds of kids in another survey saying that they wish they have waited to have sex. And that's also, something that's good, I guess, because now they're being aware and they're thinking of their bodies, they're thinking about their lives, and also outside the future that they want to have. And I think, like I said, with proper information, this will be great for them to have, and like I said, for them to be given to them in schools will help them a great deal with this. But it has to be a two-party thing, not just be one-sided where it's just the children wanting to know and the school's not willing to provide the information for them. It is acted into the curriculum, and parents also should be involved. So the parents should not shy away from it, because figuring that you're invaded on an era where they should be only involved in, because like I said, there's a lot of kids out there that is not able to have someone or go to someone to speak to them about their concerns and the issues that they're having. And with peer pressure and everything in school today, that I think, not just in schools, but I also think that children having some place that they can go to would be a great help and benefit to them also. Some of the diseases out there, you have the herpes, you have hepatitis that's going around, and you have the trichinosis, you have gonorrhea, you have syphilis, and not to forget AIDS. Besides that, from AIDS, there's not a vaccine per se that is out there that can help them. There's a lot of medication that they have to take every day to help with that disease, and it just helps prolong their lives. A lot of them die from the disease, and also die from a lot of pneumonia, from that, all these different, being resistant is so low, the body just breaks down, little each time, and all these different diseases come into the body because the immune system is very weak. And I've seen patients also with that when I work at the hospital, that we can just, admit a patient, then discharge the patient, and the patient's right back again because of that problem. The system has just broken down, and being up there, not in an environment, in a good environment per se, and everything just, comes back on them. They end up with a cough, and then here comes pneumonia, and then, something else, and then they end up passing away. But I think with good information and an open mind, it can work, and it'll be good for kids to have, because no one wants to see a child go down the wrong road, and a lot of them have a lot of unwanted pregnancies, not because they want to. If they're here with a child, and they're a child themselves, and then it's like they're lost and don't know what to do, and it's not everyone has someone willing to help them or is there for them. They're one of the state. The state has to step in and help them, and they still don't understand exactly what they're doing. Because we have a lot of teenagers that come to us too. They're being seen as a patient as well as the babies that they have are being seen as our patients. So we have mother and child there, a whole family there, and sometimes it's one, sometimes it's two. They come back again with 2 kids, and stuff like that. So I think with good education, an open mind, parents get involved, and if parents can't get involved, at least there's someone there that these children can go to for the help and good information that would help them. Any questions? Thank you very much.